Beautiful.
Normally they can't adjust that thoracic area. Normally it won't move.
Yeah, that's more normal.
Thank you, Lord, for Dr. McLaughlin. This is like, finally, somebody gets it. Typically, my first rib goes out. I was training jiu-jitsu for a while, and after about like 6 to 9 months, I got into what's called a triangle.
Okay, yeah.
And so I got some tears in that first rib, and in my pec muscles, and so my clavicle and my first rib and my shoulder, that front humerus tends to go forward.
Okay.
So they'll adjust, pop that back in, pop the first rib in, and I'll get relief for about a week, and then it's right back to the same stuff all over again.
Okay. One of the difficult things is that our posture creates the environment for where our bones are going to want to be, right? So even before you went and did your triangle, the alignment that we're in when we're doing activities makes injuries more possible or a greater level and degree of, to the extent that they are. For instance, when our head goes forward, our ribs and our upper back elevate.
Right.
Right. So if our ear isn't over our shoulders properly, and then obviously if you're in a triangle, right, your head's really pushed forward, so that the soft tissue then tears.
Yeah.
And we can adjust the vertebrae, meaning that the rib joint gets compressed, and we can. So if the joints swell up, they're going to displace the rib more, and we can compress the joint. But if the posture when you leave the office is still with your head forward, it's going to not last. The alignment of our spine determines the stresses, and so you're getting adjusted, but there's not really any postural work. They're not really looking at correction and anything.
No.
Okay. And
no soft tissue work, no adhesion work, none of that.
Okay.
Which I have gotten gua sha work on the side, but it's just like you said, surface most of the time. So that's why I'm here.
Okay.
I have been getting that atlas adjusted by a different I go to 2 different chiropractors.
Okay.
You're my third, hopefully my last one.
Third time charm. Okay. Have you heard the word lordosis before? Maybe
yes.
From
yes.
Okay. Mm-hmm. So that means the curve that our neck should have. And the answer to the question is, how did the vertebrae go out of position? And they're actually forced out of position primarily because of the loss of curve. So when the curve goes straight, see, the vertebrae are supposed to be kind of sunken in, and when the curve goes straight, they actually move posteriorly. The vertebrae actually displace from their normal position because of the loss of natural curve in the neck. And then that is what causes the joints to swell, increase pressure on the disc bulges, and essentially all the work gets shuttled down to your lower neck. So the upper neck is supposed to be the main engine of your spine, and then the upper neck gets tight, congested. That's what causes those headaches. But the loss of curve, which is where we come in with these dental rolls, we want to start molding the arches back to your spine. So we use the adjustment as a tool to make the spine limber, and then we want to aim your spine at the end of the visit back to this normal lordotic position. We lose the curve in our neck slowly over many years. It's not a sudden. Injuries can make it so that we want to avoid the joints, which can then further make the curve go away, but it's stretching that makes the curve lost in our neck, and it's stretching that restores it. Chiropractors taught, and some are still teaching, that adjustments can push the curve back into your spine, and it's not really true. I wish it were something where I could just lay down and we're going to adjust the atlas back into position. That terminology is vague and not really best for patients because it's not the reality of what we're doing. We're loosening joints. When you're adjusted, we're loosening the atlas, which is part of what's necessary to actually put that curve back in your neck. If the vertebrae are all locked and stiff, we can't stretch the curve back into your neck. So the first thing has to be adjustments, massage, to get the spine limber so that the stretching that we're going to do at the end of the visit is actually beneficial and effective. If we're all stiff, then what will happen is you're actually not going to bend at your atlas. You're just going to bend where you're typically everybody's injured in the lower neck, and therefore people might say, well, I tried stretching or I tried yoga and I got hurt doing yoga. I got hurt stretching. Well, right, because when you were stretching, you were only bending where your back was already loose.
Yeah. You
weren't bending evenly. So you need to be adjusted, but it's difficult because I go against kind of the grain of chiropractic where we have this mentality that we're putting bones back into place. It's not really, maybe for a few seconds, maybe for 10 seconds or 15 seconds.
Right.
But the ligaments that wrap the spine have to be altered. For instance, there's a tight ligament on the front part of your spine called the anterior longitudinal ligament. Runs from the foramen magnum all the way down to your pubic bone. And this tight ligament on the front So even if I adjust and push the curve back in, the tight ligament pulls it right back out. And the posterior ligament, so there's an analogous ligament on the back that's supposed to play kind of like a tug of war with each other. The posterior ligaments are essentially all stretched out. So there's inner spinous ligaments, inner transverse ligaments, and because of our posture, primarily with kids and life, everything is forwardly rotated. Mm-hmm. So these posterior ligaments are all stretched out. The ligaments on the front are really tight. So even though we adjust the spine, do you get the idea? The rubber bands back here are all flexible, and the ones in the front are all tight, so we keep getting pulled back forward. So we call this mirror image stretching. We have to make the structures on the back like each other so we can go deep enough to actually stretch the front part of our body without upsetting too much the back structures where there are all this feeling back here. This is why we see elderly people going forward to get away from. They're getting away from these, ow,
right.
Ow, ow. And we keep going forward as a means to take pressure off of these joints. So the joints are little handshakes back here. And there's fluid in that capsule. And when we adjust the spine, what we're really doing is we're compressing that capsule. Little air bubbles get released from that joint, makes a sound. It's pretty cool. But is that the whole purpose of being adjusted? No, we're trying to adjust the joint so that we actually can stretch this ligament on the front so that the joint will stay compressed, stay with that curve in the spine. The curve allows the weight to be evenly distributed. When the curve goes straight, all the weight goes right down to these last two guys. Hence why these last two vertebrae are 99% of surgery, and the ones in the lower neck are 99% of the surgery. So the alignment determines where the stresses are going. Is there anything going down the arms? Any numbness or tingling, burning? Nothing going down the arms ever?
I mean, when the shoulder's out, I feel the pain into the front of the shoulder.
And that started after the triangle? Or?
Yeah.
Okay.
Yeah.
All right, we'll do some soft tissue work on that. We'll see if we can find if there's actual injury in the shoulder. And how has that changed? How long ago was that injury, you think?
Oh, like year and a half. A year and a half ago. Year and a half ago.
And so when you move the shoulder, for instance, right now, does it cause is there anything that makes it aggravated?
It's just like it's not aggravated. It just feels like I have limited range of motion, and I can feel some tightness and like ick.
Okay.
It's a little pinching, but it's not pain.
Okay.
I'm not in pain.
Okay.
But when that rib goes out is when I feel the most pain coming in down.
It kind of shoots down the arm?
Oh, yeah.
Yeah, we call that thoracic outlet syndrome. What's happening is there's three components to the nerves, the brachial plexus, as they leave your lower neck. So the vertebrae in the neck can go towards the back, and that pinches this funnel. The rib in the upper back can come up, and that pinches the funnel. And then the actual tissue that the nerves are sitting in can be acidic and inflammatory, and that irritates the nerve. But you're essentially hitting that brachial plexus, or the nerves that are leaving your lower neck there.
So, like this one I can lift.
Mm-hmm.
Like it starts to kind of get uncomfortable right about there.
Okay.
That is as far as I can lift it.
Okay.
And then, whereas this one I can go a little bit more. And then, so it's like typically when I take my clothes off, like I have to compensate. Like I can't lift.
Right.
I can't. And then I have limited range of motion crossing over to go up. So I have to come this way. Like it just feels like pinching in the front. Almost like that tendon gets out of the groove. That's the only way I can describe it.
All right, your arms go easy here. Little sit up for me. Take a deep breath in, and then let all the air out. Yeah, a little bit. There we go. Deep breath. There you go. There you go. Relax your jaw. Relax. There you go. Deep breath. I got you. One more. There you go. Beautiful. Okay. Stay right there for me.
Normally they can't adjust that thoracic area. Normally it won't move.
It's almost like it's practiced his whole life.
Magic hands.
Exactly. Okay. All right. There we go. Oh boy, yeah, you're definitely gonna unglue you a little bit here.
Yeah.
All right. Yeah. I mean, it's about as. All right, so this is the side of your atlas, right? So I can barely feel the wing of the atlas on the left, and then you got this Frankenstein bolt sticking out over on the right. When I tilt my head left, the bones all shift to the right, and then you've dropped your right shoulder, but essentially you've stayed in left lateral bend. Eventually you're going to have the compensatory injury of pinching the left lower because you're in avoidance of the right upper. And so this, ultimately the only way to put this bone back into place is through stretching. And one of the ways we're going to do that is as we bring the curve back in your neck, we're going to have your head turned a little bit to the right for a period of about a month to actually stretch the head back and to the right. Make sense?
Yep.
Because you're essentially, do you sleep on your left side?
I do.
Most of the time? Yeah.
Yeah.
To get away from, again, this right side. But do you
Yep.
see how sleeping on the left side further drifts you?
Yeah.
Oh, moving the bone to the right, the head's tilting left.
Even if you use a special pillow?
Well, no matter what, so you can't lay on your side without the shoulder that you're sleeping on elevating, right? They always show in the commercials, people like this.
Yeah.
It's not possible. The shoulder's going to go up
Oh.
and forward. So it's like, okay, the head's level with the... Does that make sense?
Yep.
How you doing, everybody? Right? You have to actually have your head level now, you have to be like, now we're level, the head to the shoulders. Does that make sense?
Yeah.
Because I elevated my shoulder up, it's taken everything out of alignment.
Right.
So you cannot, please somebody leave a comment if they can sleep on their shoulder without elevating it, right? It's gonna slide upwards. And so essentially you're tilted to whatever side that you're sleeping on.
So how are you supposed to sleep?
On your back. All right, real gentle here, real easy. There we go, I got you, not gonna hurt you, easy. Okay, yeah. Clunk. Easy, easy. Yeah, that's more normal. Do you see what happens, right? The left side's already closed.
Yep.
That's why it's always easier for me to get adjusted on the left side.
Yeah.
You don't even really need this adjusted. We want to focus on that right upper part. And so it's going to be, you massage the right side of my neck a lot longer than you massage the left side of my neck, and the answer is correct. You're going to see me spend way more time.
Whatever you gotta do.
Okay, we'll fix it. Right there on that bolt. We got to get off the left. The ligament on the left front is actually what needs to be stretched. But it can't be stretched if this backside won't come together. Come together. Yeah, it's got to come together back here.
All you chiropractors need to come together and
That's
learn
right.
everything you know.
I don't know. I wish it was that easy. It's like art. Every chiropractor is like a chef, and they want to cook their steak how they want to cook their steak.
I know.
They don't want to be told. I don't think Gordon Ramsay wants to be told by other chefs how to cook. He's got his way of cooking, and
But
perhaps it'd be better if we were open-minded. But
There's definitely a lack of education for the patient in the soft
Sure.
tissue and the,
Sure.
you have a certain understanding that you're going in there and that you're going to get fixed. In reality, you
Right.
can feel you're not, and it's like,
well, someone at home might be saying, "How do you know that, doctor? How do you know that adjustments don't change position?" Well, my dad's a chiropractor. He's been doing this for 40 years. And he was doing what they could call the orthodox chiropractic, right? Where we're adjusting bones and we're telling people that their body's out of alignment and we're going to adjust the bones back in alignment. And my dad takes an x-ray before the care and then does a series of care, takes another x-ray, and they're exactly the same, right? And then does 5 more years of care, takes an x-ray, it's exactly the same, right? You're not changing permanently the position of the bones. So it gets to the point where you're like, oh, let's not even take any more x-rays, right? We don't even try to, a look at the position. Have we changed anything? The data rolls that I'm going to show you, very easily and very quickly, they become such that when you get on them initially, they're very difficult. Your back doesn't want to be curved. And then when we get on the data roll, your back wants to be curved, right? The normal position that your spine wants to be in needs to be lordotic. But yeah, this rib here comes up also. We got to push that rib down. We'll get to that in a second. Little crunchy.
just a little.
Yeah. Yeah. All right.
And what's funny is that I get worked on pretty frequently,
Okay. Good.
and yet it's still super crunchy.
Right.
But it's because of all the stuff you've explained.
Yeah, it's like saying I went to my dental hygienist to get my teeth cleaned, but I'm not doing any home care, and so it's not lasting.
Mm-hmm.
Right? People might get frustrated at the concept of having to keep getting adjusted, and you're right. I mean, it annoys me that I have to keep doing dishes in my sink every day, and I have to take the trash out, and I have to keep brushing my teeth. Right? Welcome to Earth. We have to participate in the care of our spine, in the care of many things, in maintenancing them. It shouldn't have to be every day, right? And there should be a level of you being able to care for yourself at home. And that's not being taught, is the point. We have to be taught how to care for our spine. It's not all on the practitioner to be the one, solely responsible for cleaning your spine.
Well, and then the first chiropractor I was going to, like, I kept getting all those migraines because the atlas wasn't getting adjusted at all. So then I ended up going to a Gonstead chiropractor who was a little bit more specific in adjusting that atlas, but then they weren't adjusting the first rib. So it's like I would go to one to get everything else done, all the ribs put in, and then the other one just for the atlas.
No.
Yeah.
Doing good. So when we have injuries, all the fibers are aimed in the same direction. And then when we have injuries, they tear
Right.
in a knotted ball of yarn.
Right.
And the kind of the goal of massage and soft tissue work is to comb those fibers in a way that we can untangle them. Their total length becomes less, like tangled headphone cables when they're tangled up, right? So your range of motion goes down. And I can't bring my arm up as high because the total length of the cable is not long enough anymore.
Yeah.
And so your range of motion decreases. Again, and then the body kind of protects itself, it tightens things up to anticipate a sequel. It thinks you're going to get into another triangle and then have another injury. And so, like right in here, this is a little too crunchy. We want to clean all this up.
And I'm a tough chick, so I can handle.
All right.
I can handle what you need to do.
All right, good. All right.
Oh yeah, I can feel.
Mm-hmm.
Oh, that's gunky.
Mm-hmm.
Normally when I get work done, the focus is on the pec. So I don't even feel that over the
Interesting.
joint because they stay away from the joint.
The pec really is going to be changed through when we're stretching in a minute. We're going to have you stretching with your arms above you from the side and then above your head. That's really how the pec really changes. It has to be held, stretched, but injuries need to be untangled. You have to go in here and actually comb them to untangle the fibers that get knotted up and gristly and crunchy. And that's really the idea of, was it Wagyu beef or however you pronounce it, right? It's like there's no scar tissue, right? There's no injury. That's why it's so tender. The more scar tissue that's in the meat, the more chewy it is, right? It's like I'm the first to get taken out in a cannibal society. Get him! Get that chiropractor! He's been massaged his whole life, right? Oh, you're gonna be just fine. No, that was so mean. I probably had like 4,000 or 5,000 adjustments in my lifetime. Exactly how much I've been massaged.
I don't know, my meat might have more sazon in it. It might choose the sazon. Give me the sofrito.
Yeah, we gotta stretch. Essentially, when we're on our back in a minute, we're going to do this. We're going to have the arm to the side,
Yeah.
and then all these angles, using even the left arm to help you, we want to stretch the shoulder back.
Thank you, Lord, for Dr. McLaughlin.
Now, none of this is causing any
Did I
pain
say
to shoot
that too
down.
loud?
This isn't causing any pain to shoot down.
Nah,
Okay, good.
no.
If that happens, let me know.
No, this is
If it's just local pain where I'm pushing,
this is like finally.
oh,
Yes. Somebody gets it. I've been living vicariously through your videos for too long. How long have you been on YouTube?
we started right after COVID, right?
Oh.
So, like in early 2020. Yeah.
What a great idea.
Yeah. My sister had been doing it for years prior, and so she'd been asking me to do some stuff. I was saying no thank you, and then that was the kick in the butt to start doing some videos, start doing some social media. And
It's great. It's
yeah.
quality.
Yeah, no, it's good stuff.
quality work. I think that, like, when I told my husband I was going to be coming for like an hour and a half, he's like, to a chiropractor? I was like, he's different. And then I showed him the video and he was like, oh, wow, that's amazing. I was like, I know. Definitely not the norm, which is a good thing.
You know, my father practiced what you might consider the norm and then didn't have the results that he wanted.
Yeah.
That's really what he taught my siblings and I, was that it's like a bolt that didn't turn, and so what do you do, just give up? No, what happens if I just put some WD-40 on it and try again, and then you keep working these areas until they're untangled, until we get to a place where no massage, no adjustments are difficult, that nothing that I do on the table should be painful. There is no normal tenderness in the spine. There is no normal restrictions. It's like the car doesn't come from the factory with dents. Something happened to it. Traumas and life happened.
Yeah.
You know, we have this way in our world to, like, I don't know, act like it's just genetic, or it's just, everybody in my family's got bad posture. It's like, no, it's still something that we're forced into.
Yeah.
You know, and it's easy to drift down this river, but all right. Yeah, there's a piece of foam. We call it the Denerol. It's designed to go between the shoulder blades, and my sister makes a foam, her little own designed roller. They both have the same kind of purpose of going in between the shoulder blades, and we can use them to help hold these ribs down.
Okay.
And again, it's to compress these joints to allow the shortening of the ligaments on the back that have been stretched out all too often, and then to give some level of opportunity for the front to slowly be able to stretch open. And that's ultimately the only way posture change can be achieved. The only way for there to be a lasting change is to be worked on so that we can progress deeper and deeper on these stretches. That's what need to see you next week. You know, that makes sense. The visit frequency is to make your stretching progressible, meaning that it gets easier and you go deeper, and you see that there's, you know, it was difficult at the beginning and now it's, you know, I can fall asleep on it.
Yep.
Right? That's what we're looking for, is no resistance, no difficulty. If you get on the piece of foam and you go, oh my gosh, this thing is ridiculously difficult, it shows the disparity from where your body wants to be and where you're supposed to be. And that's what we call subluxation. Subluxation is the bones aren't dislocated, they're sub-dislocated, they're crooked, and it's the ligaments and soft tissue that wrap around the spine that define their position. The problem is chiropractic and x-rays were both created the same year, 1895. Röntgen invents the x-ray machine, and D.D. Palmer starts chiropractic, and so we became like conjoined twins with the x-ray machine. And what can you not see on the x-ray machine? Soft tissue. We can't see ligaments, we can't see discs, and so therefore the value and the importance of altering that soft tissue wasn't grasped very easily until we got the MRI machine and we could start seeing the discs in the body and go, oh, okay, we have to actually, stretch the rubber bands that wrap the spine that are invisible on X-ray. And that just took about 100 years. It took 100 years to figure out that.
So how did you learn all of this?
So there's a technique called chiropractic biophysics. I'm not the inventor of the Denerol. There's nerdier chiropractors, believe it or not, that all they talk about is curve. All they talk about is reducing forward head posture, right? You understand? And so how do we actually do that? Don Harrison is the father of chiropractic biophysics. He's passed away. His son, Dee Harrison, is the one who runs it now, and he's the most researched chiropractor that exists. Something like, 600 peer-reviewed papers on how to actually change posture. It's like all these guys think about. How do we actually permanently, what you just brought up at the beginning of your visit, right? This rib is out of place.
Mm-hmm.
That's the question they answer all the time. And the answer, in short, is stretching. You have to stretch. In the opposite, mirror image stretching is what's necessary to take you. We take you to the opposite position of what you're used to, and we hold you there. It takes about 20 minutes for the ligaments to permanently lengthen. And that's not to say that 5 minutes is not beneficial, but only insofar as it gets us to 20 minutes. 20 minutes is where the ligaments start to lengthen. We call it ligament creep. the ligaments start to become longer on the front, the ones that have never been stretched, and stretching those counter-coup ligaments is what's required to actually change your posture. Again, adjustments are necessary to unlock the spine so that the stretching is safe and effective.
I need a Polly Pocket version of you to take home with me.
Yeah, that's right. Get out here, Ed.
Polly Pocket. I remember Polly Pocket.
I'm old school.
That's funny. We had someone else in here 2 weeks ago. We had like the old Nickelodeon shirt and had all the. It was fun to see.
I actually went on one of the, oh gosh, what was it?
Double Dare?
Double Dare.
Exactly.
Yeah, it was on one of the
Exactly.
episodes. Yeah.
That's awesome. I
Yeah,
love
when
that
I
show.
I was younger.
I probably saw you on there then. I watched like all those episodes, man. My favorite episode of McGee and Me was the one where they kind of like do a mock, Double Dare episode where he's doing all these competitions on like a show and he's not doing well or whatever. But
Do you remember McGee and Me
you ever
at
seen that
all?
show?
No,
It was
no.
like the
Christian show.
90s Christian. It's great. I still love it.
Yeah, in order to bring your shoulder back, all this has to be compressible. If this is all knotted up and
Yep.
filled with fluid,
That's never been worked done.
you can't bring your shoulder back, which means you can't stretch the pec. How can you stretch the pec if this won't move out of the way?
Right.
This has to be compressible back here.
It has to be able to move.
Correct. Yeah, you got to be able to retract the scapula
Yeah.
back. That's part of what you were saying earlier. Getting your shirt off or under.
Yeah.
You can't. Basically, the way I interpreted what you were saying was, I can't retract my scapula.
Yeah.
And why can't you retract your scapula? Because this is all in the way.
Yeah.
You got injuries up here that have elevated these ribs, and we got to compress these ribs and ultimately stretch these ribs down so that there's going to be room for the retraction of your scapula.
See, and I was told to do lots of rowing on those rhomboids to
Sure,
be able
I understand.
to raise the shoulder.
It's not a muscular problem. You don't have a muscular problem. You have a joint ligament problem, right?
Yep.
So any active exercise is going to activate your muscles, not necessarily compress the joints, right?
Yeah.
Or stretch the ligaments that need to be stretched. So
Yeah, because
It-
the other thing I was told was to do some free hanging, and that just ended up lifting up that first rib and
Right.
bringing the clavicle out,
Right.
and it was just, I would try to free hang for functional movement to try to
Right.
strengthen, and then I would just jack myself up for a few days.
I understand.
Wow, I actually feel it more on that side.
Right. Yeah. One side is tight, the other side's abused. We always hurt where we're abused. We don't usually hurt where we're frozen or where our back is locked.
Yep.
And you kind of pointed to it earlier when I was asking about your lower back. You're like, well, I had a problem on the right side. It's kind of just gone away. No. No, you just learned to avoid it.
Yep.
You've learned to run away from it, and then you don't notice it anymore, but it's still in there, and we're gonna run to it in a minute. We're gonna find it.
I just thought all the core stuff that I was doing in jiu-jitsu helped.
It can. I'm not saying it can't, but it's a short term
Right.
answer.
The structure's
Right.
still not there.
How can I depend on a fatigable structure for the thing that gives me stability? Right?
Right.
If I ask you to hold a bowling ball with your arms out and stretched in front of you, everybody's going to drop it at some point. You can't do it forever. How can your core strength be the thing that stabilizes your lumbar or stabilizes your spine? It's nonsense. Your alignment is what gives your spine stability. There we go.
God dang.
Mhm.
I was not expecting that.
If it's too much, you can.
No, I can no, I welcome it.
Okay.
I ain't no weakling.
Strong.
How long have you been doing jiu-jitsu?
Well, like I said, I stopped a couple months ago, but 2 years
Okay.
total. And then I was injured for like 6 to 9 months out of that. So
Okay.
I'm a 2-stripe white belt.
That's phenomenal. No, I get it. I know it's like, what, 7 years or
Oh,
8
yeah.
years to even get your brown or something?
Yeah,
like
it's
purple. It's like 14.
very long.
Right.
Yes.
I did Taekwondo. I had 2 years. I had my black belt.
Oh, yeah, that's Taekwondo. I know. Yeah. Well, us jiu-jitsu people make fun of you people.
And rightfully so.
I mean, what I love about jiu-jitsu is, like, even if you just did a year of it, what
Yeah.
you learn in a year
Sure.
is enough to, like, you can defend yourself
100%.
really well. Like, because the majority of the population, they don't know anything.
Correct.
That's
So,
what I need to do.
oh, it's amazing. It's,
Oh, baby, yeah,
We had a stalker, like for real. for
really?
years.
Yeah, way too tight in here.
Yes.
All this is what's causing the lower back.
Yep.
Both sides, but these kind of speed bumps that are in here.
Yep.
Mm-hmm.
So I fell over my daughter acting like a cat behind me when I was in my early 30s.
Mm-hmm.
And all of those ribs got
Mm-hmm.
really tore up.
Mm-hmm. You get to see they just bolt. Boop, 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 boop.
Ugh.
Mm-hmm.
I can feel it wrap around to the front.
Mm-hmm. How quickly the mark comes up also shows how much is in there. It's like running a vacuum cleaner. The more you hear, the more dirt that's in layers in the carpet. Right there.
I got plenty of that for you.
Yeah.
For now.
Mm-hmm, mm-hmm, mm-hmm.
Man, that's crazy that you had a stalker like that. That's just insane.
Mm-hmm.
Yeah, it was.
That's scary.
Yeah, I didn't sign up for this.
Is it because of the videos and
Yes.
stuff?
It was
Really?
directly because of YouTube.
Mhm.
Like, and
Mhm.
yeah, I can tell you even more when we're done, but it's God was so good.
I'm
Mm.
so
So
sorry you
grateful.
guys went through that.
But it was really crazy.
Well, me and my family are a phone call away.
Yeah, a little tight. All right. Okay. Okay. All right, maybe sit for me, face to your left for me. Go ahead and tilt your head left for me, tilt left. There we go.
What was that?
They don't teach that in jiu-jitsu.
No.
Okay,
No.
I'm trying to get their ear. Go ahead and tilt your head right for me. Okay. And go ahead and tilt to the right for me. Okay. Come on.
What is that?
It makes sense to try to get your head to sink in and then put your hand back down, try to relax. The idea is that we press your head into the mold. Makes sense? And then we can do a little bit of right rotation to work that right side. Makes sense? That knot on the
Yeah.
right side, maybe using this right arm.
Yeah, I can feel it.
You want to push, try to. The first half dozen times you do it, your neck won't really want to sink into it. That makes sense?
Mhm.
And the more we do it, the more your neck will comply, and the back of your head will start getting closer to the ground. Your neck isn't used to being curved, and that again is where all that adjustments is to make your spine like itself again, so it actually can be stretched. And that's the first phase of care, is we have to start aiming you back into this curved position. Now this guy's right in between your shoulder blades, and you have your knees bent. Then this guy above, arms are going to be up, and you kind of slide a little bit,
Yeah.
and then let your arms kind of relax now.
Okay.
Get the idea?
Yep.
You try to stretch. You want to have pressure going inwards and down at the same time. So you achieve that by sliding a little bit. That makes sense? To getting that downward pressure.
Got it.
You want to, get that pressure here
Yeah.
and then get it to kind of slide downwards to hold that rib down. And then also to stretch open the chest. Make sense?
Yeah.
And mastery of this is your main goal. where all of this is easy and there's no difficulty. You have to stretch. My sister makes this guy a little less intense, but the same kind of principle goes between the shoulder blades, right? You have to get something. Go ahead, let me show you this guy. I got you. There you go. And she makes this guy, and you can kind of roll around on this, and you want to get that exactly right over that spot.
Oh, wow.
Right, all of this has to be easy. Yep, and you go back.
I just felt more go in.
Yep, yep. Yep, you got it.
See, I try to do this at home with like the spiky one, and it just like doesn't get in between.
Yes, you've got
So
it.
this feels really good. No, it feels great.
Right.
This is awesome. Where has this been my whole life? I think we need to give these to our kids.
Okay, I got you back. I got you. Breathe for me. Relax. Here we go. All right, breathe. I got you. Exhale. There we go. That's where we're going.
Yep.
Now we gotta start working on pushing all that in. At the same time, we pull the shoulders back. Let's see how it feels. How it feels right
I'm
now.
feeling more range of motion.
Yeah.
I still feel a little bit of pinching in the front, but it's I mean, I can lift it higher.
Excellent.
This one, maybe that's
A little more restricted there.
Yeah.
We have to, what you want to do is when we're targeting with that stretch, we want to hold it, you right to that edge, and then if you have to put a book behind your head, that's fine, but you want to kind of hold it there, and then kind of work that edge while you're on these stretches. Make sense?
Okay.
That's how you're going to change that, is through 20
Okay.
minutes, we got to get to 20 minutes.
Okay. So is it 20 minutes total everything, or am I doing 20 minutes up here, 20 minutes down there?
Each, really it'd be 20 minutes on like the back one, and then 20 minutes on the neck guy.
Okay.
They have to be used independently, but yes, you
You're
could do
giving me
one.
more reason to just lay down and meditate.
Slow down.
My doctor told me no moving for 40 minutes.
It's me time, leave me alone, let mom stretch.
Put a
Yes.
podcast on, listen to something, music, yeah.
Can't cook, I'm sorry.
Right. I gotta stretch.
You did great. All right,
you
awesome.
so
Thanks so
much.
much. I appreciate